The purpose of the Lipiscan is to allow us to get a more up-close look at the eyelids to see the condition of the oil glands. So I always start by cleaning the probe that's going to touch the lower lid first. And we come over, we clean the headrest, and then we clean the chin rest. And let me log in. So the login is Lipiscan, and then the password is Lipiscan. And if you ever forget what the actual name was, this machine also says Lipiscan right here. So we're just going to go ahead and do a test patient. We already have one up here. If we were going to add a new patient, we would click add patient, type in all the requested information, and then click save, okay? In this case, we already have a patient that we're going to do, so we're just going to click cancel. We're going to click test, and then we're going to say, hey, we're going to do a new test. So you're going to click new, and it will load an empty page. I'm going to get a tissue because I always wipe off the probe again with the tissue so there's no extra alcohol on it. And then when doing this, it's going to feel a little awkward for the patient. You're going to have them put their chin here for the right eye. If you ever forget, it does say OD, OS. They're going to sit crooked, and their eye needs to be lined up under this little indentation right here. So this is where we're going to get the center of the pupil. So you're going to have her look up. Go ahead and look up. And then touching the screen will allow you to line it up as well. This little guy is the capture button. Over here is what you're going to use to be able to get the scan in, or get the image in focus. Once it's in focus, you'll click this again to take away that. You're going to want to make sure that the screws are facing away from you. The purpose of it is to go at the base of the lashes, pull down, and then push up. So we come here, we go down and up, and you can see that the glands are flipped here, so we'll go ahead and capture it. And we're putting pressure more on the bone than we are. That's a sucky one.
Oh, sorry.
No, it's not your fault, it's mine. I flipped it too much. Come down. So you want a good connection of the probe. So where the lid is flipped over the probe. So you click your capture button. And you can see that there's no white marks. It'll load it. You can see her oil glands right here. And so then we're going to do the other eye. So you'll go ahead and move over here. Again, we're going to touch the screen to get it lined up. Look up. We're going to reposition her head some. Get the imagery done. Look all the way up. There you go. So you want to make sure that the eyelid is almost in the center of the screen right here. And so you'll look up. So we're going to pull down and up to where it has that connection over the probe. And you can see the glands right there. And you can see her glands right here. And then if we were going to analyze it, then we'd click analyze. And then Dr. Johnson likes this middle icon right here. Looks like some electro waves. We want to make sure, because otherwise that's just an outward appearance of the eye. And then this is just, I don't know how to describe that, but it's a different view. But she likes this view right here. And then if we were going to upload it, you click the little jack in the box, do save report as PDF. You're going to make sure that you click gland image full report for both eyes, confirm, and then it'll let you see the route where it's headed to the first computer at check-in. You'll then turn around and you will message on your computer to whoever is at the front desk at that computer that you need to have they need to upload the Lipiscan to the patient's chart and give them the last name. And that's it.